if our food isn't sterilized before it goes into our gut, now we're looking at overgrowth. Now we're looking at overgrowth of bacteria, yeast, all sorts of things. And that yeast can cause a lot of...
With this podcast, what we're trying to do is have real, authentic discourse.
Rachel, it's good to have you here today.
Hello, thank you. I'm glad to be here.
Yeah, I've been looking forward to doing this podcast with you. We got to spend pretty much most of the day today together, and I think the people that are going to be listening to this are going to really enjoy this. I'm personally pretty passionate about the topics around, nutrition, exercise, sleep, and how that affects your overall mental health. So I'm excited to jump into some of this with you today. So as you know, this is our podcast. We launched it last year. It's called Treatment Redefined. And really the goal of it is to have thought leaders in and around the areas of mental health, addiction, substance abuse that can kind of shed light on, where treatment's going and advancements that are going to be happening. So this is going to be a fun little area to talk about. So I thought maybe we'd just introduce you. You're a certified nutritionist.
Yes.
Working with Flourish Integrative Pharmacy. So
it depends upon what part of the South you're from, how you say it.
I am Texan, so you're going to have to bear with me a little bit today. So out of Oklahoma City, right?
Yes.
And you do a lot of work with Addiction Counseling and Wellness Center out of Edmond.
I do, yes.
Okay, and I know those guys pretty well. Kyle McGraw, that group
great.
Up there, they're outstanding. Known them for a long, long time. So maybe just by way of introduction, just give people just a touch of your background, how you got into this, and then we'll jump into a couple of neat topics today.
Well, I fell into pharmacy. My dad just happened to know the relief pharmacist that was working for Flourish at the time, and he happened to stop by because he was building a building for the people next door. Anyways, picking up a check there, and she was like, "Hey, is Rachel looking for a job?" And he's like, yes, she is. Get her out of my house, please. So I wasn't really sure about pharmacy. I mean, I knew pharmacy from the standpoint that, you pick up prescriptions there, but I didn't know much more than that. And so Flourish was really a godsend in a lot of ways. Family owned, very family oriented. Their mission statement begins with recognizing that people are God's creation. We shall create a loving and compassionate experience for all. And that really stuck with me. Like, it doesn't matter what you believe, it doesn't matter who you are, it doesn't matter what kind of day you're having. If you come in here, we are going to treat you with love and respect and compassion. And that really stuck with me. And so I've worked there for 18 years now.
Wow. Congratulations.
I've been
That's
around.
Nice.
Yes, yeah. Would have never thought when I started that I'd be there 18 years later, but here I am. Done a little bit of everything there as far as technician goes. I've been a pharmacy retail technician. I've been a compounding lab technician. Okay. I've worked the floor, and by floor, I guess I mean the nutrition side. So I've worked that a fair amount, and so I learned a lot on the job and listening to the nutritionist prior to me, all of his knowledge that he had, which has been really, really helpful. I think all of us have our own nutrition journeys. Mine started in college. Yep. When I went to college at first, I was a dance major at OCU, so Oklahoma City University. So it's a pretty premier dance, arts-oriented university, and they have weight requirements. You have a nutrition class your freshman year of college there if you're a dance student, but it's still very basic, even though you're spending a semester in it. And a lot of it was based off of the food pyramid and things. And some of that, I think we're learning now, is older theories. It's very outdated, and we've got some better ways we can do things. So that's just kind of my personal journey with nutrition, is going from some of that and finding what works for my body and then what potentially works for other people too. So
in this role that you're in, you're you're working with people that come through the pharmacy.
A lot of times, yes.
And they're looking for are they looking for like nutritional guidance? Are they kind of seeking it, or is it something that you're presenting most of the time to them as things they should think about?
Sometimes people will come in with just a basic supplement question like, hey, I heard magnesium is really great. I heard lots of people are deficient in that. It's like, yeah, like 60% of people. Mm-hmm. You know, if you're having trouble sleep, other things, this could be something that fits for you and works. So sometimes they come in with just real basic questions like that. Sometimes I see people that are even going through or have gone through cancer treatment. Mm-hmm. I don't know enough about cancer to help maybe on that side of things, but we can really help dial in their nutrition and what they're eating so that they get the best results throughout things like that. So, yeah, we've got a wide variety of people, like you said, addiction patients. And I had a patient come in yesterday. Her brain has been so hurt from cancer treatments. And so we walked through some testing that she was doing on her own and what she needed to do. So people are coming in for a wide variety of reasons.
Wow, I can imagine. Nutrition it feels like in the last 5 or 6 years that there's just a lot more attention around like nutrition and vitamin deficiencies. There's lots of thought leaders. They're all over the place. You know, I follow a number of them on social media.
Yeah, you can get a wide variety of opinions on social media.
You absolutely can. And sometimes I find myself wondering, I feel like I know these people, but I don't. And they're giving a lot of advice. But then, as I study it and look at it, there is a consensus around a lot of different things around certain types of deficiencies people have. But as it relates to, say, the population that we serve in Inner Health and that you get to work with Kyle McGraw's group, what are, just give me kind of a feel for what are the things you're seeing, with patients that go through, that are dealing with substance abuse, that I can only imagine that their bodies have to be hurting and or deficient in some key areas.
Definitely. Some of the top things we see with particularly addiction, substance use disorders are things like zinc. I'm going to say just kind of even a blanket B vitamin, but B6, B12 are some of the other big ones that we see a lot of. Magnesium and D3. D3 we synthesize from the sun. Yeah, we can take a pill for it, but these people have probably they've not been taking care of themselves. They're not getting outdoors. They're not working out.
Is that the best source of D3, the sun?
Yes, it is.
Okay, so let's talk about that for a second. And I wonder sometimes if, there's this constant battle of the sun is good, it's healthy, it's where you can get vitamin D from.
Yes.
But you also need to be super careful and try to stay out of it and lather yourself with sunscreen as soon as you wake up and before you go to bed.
Yes.
And I wonder about that, in that even a lot of the sunscreens have a lot of harmful chemicals in them.
Yep.
And maybe the best sunscreen maybe should be a zinc type of application. But I'm just kind of curious your thoughts on this. Mine personal, and you're the authority on this, is getting sun is a healthy thing. I think back in the old days, even on hospitals, they had sun decks they would put patients, and there's got to be some sort of healing properties that come from this. Yeah. So as it relates to the sun, I just wonder is it one of these things where it's as long as it's in moderation, it's healthy for you, but you should get some daily sunshine?
Yeah, I believe so. And that's something that you can even look up in your area and see, okay, hey, when is the highest sun index? When do I need to be avoiding the sun? When do I need to get out in it? My best recommendation for getting some sunlight is actually first thing in the morning. Go out, start with 10 minutes in the morning. Get that natural sunlight, get as much of it on your skin as possible. That's going to be the safest time to do it too. And then work into even up to 30 minutes or more, getting outside, enjoying that sunlight. And then that even goes into your circadian rhythm.
That's exactly
and it helps your sleep. It helps your sleep regulate. Your body, it's how we became. That's how we did everything, was based off of the sun and knowing when it was rising and when it was going down, and we knew. And so your body's timing, it's there. It's in our genetics. We just have to re-find it, and we can help our body re-find it by getting up in the morning and going out and getting that 10 to 30 minutes of sunlight. Today, I wasn't able to do that, so I drove part of the way down here with my windows down, which is why I look crazy. But I did. So I drove with the windows down some so I could try and get that sunlight, not through a window, and just kind of enjoy it, enjoy that breeze. And so, yeah, like you were saying with the hospitals in the past, having sun decks, vitamin D is incredibly important for our health. It can be cancer preventative. It can help with our brain health. There's so many things that D3 goes into.
Right.
And the best way to get it is sunlight.
And with the patient populations that we serve mutually together, a lot of our patients are deficient in that.
They are.
Vitamin D.
Yep.
Magnesium, just give us a feel like I hear about it all the time, an essential like mineral that we're completely deficient in.
Yes,
Most people
at least
are.
I think it's upwards of 60% is what I've been hearing, the people that are deficient in magnesium. And then a lot of times when we start taking magnesium, we're not taking the right kind. A lot of what you're going to find is magnesium citrate or citrate.
Right.
That's the least absorbed magnesium. It's the one that's going to send you running to the bathroom too.
Okay.
So I generally recommend something like a magnesium glycinate. It's our best absorbed.
Okay.
It's going to help us the most with mood, with sleep, and then that cascade of events from there. When we get better sleep, like I said, it goes back to the mood and all of those things. It can even potentially help with anxiety.
Interesting.
So when you're talking again about addiction, there's a lot of anxiety there.
That's right.
I usually say about 500 milligrams a day is probably the most people need. Some people are going to need more, some will need less. But that's usually a pretty good starting point. I'll even have people start with like 250 milligrams at bedtime.
Okay.
Let's see how you do.
Yep.
If you still need a little more, we can add another 250 milligrams in the morning. And even though it helps with sleep, we can still take it in the morning. It helps with that anxiety and things like that. It's not going to necessarily make you fall asleep walking around.
Yeah. So you kind of mentioned it just a minute ago. There's several different types of magnesium.
There are.
Right? I mean,
there's a lot.
There's a lot. How do you hone in on what you need, or are there in your mind, is there really like one or two go-tos for most people, like the glycinate?
Yeah, I would say just a general, the glycinate is really my go-to. My other kind of top two are going to be the malate and the threonate. So threonate can be really great specifically for brain health.
Exactly.
And I believe it can help even more so with anxiety even than the glycinate could. So
it's one of the
really
few that breaks the blood-brain barrier.
Exactly.
Isn't it? Magnesium threonate.
Yep, that threonate. So it can be more beneficial that way when we're looking again at addiction. Maybe we start with the threonate over the glycinate. I tend to gauge that based off of what the person has going on, where they're at, how bad are we right now.
Yep.
Maybe if they're just coming out of treatment, like an inpatient or something, maybe we start with the threonate and we work from there.
So give us a feel for how you intersect into this, because we're in the treatment field, and we work as you know, we talked about it today. We're in this space quite heavily, actually, and I love the fact we've entered into it. But from your perspective, how do you integrate into a person's treatment right now? Because are you seeing people often coming out of like a residential level of care or an outpatient level of care, and then do you intercept kind of with them and run any diagnostics? Is there any blood work done that kind of figures this out?
That's definitely something I can help do. I haven't done a lot of that yet.
Yeah.
A lot of the people I'm seeing are in just maybe your basic therapy.
Yep.
They've already been to a lot of that stuff, but now they're trying to continue their recovery.
Okay.
Is a lot of what I see. But definitely a lot of what we do can go hand in hand with people coming right out of treatment.
Yep.
I do have places I can send people for blood tests to order. In Oklahoma, you can kind of order them yourself, which is really nice. I'm not sure how Texas is on that, but in Oklahoma, we've got a way to actually just a website we can go to, pick out what all we want, even schedule an appointment with the lab right there online.
Interesting.
And then the patient can go to that lab at the scheduled time, have the blood drawn, and bring back the lab work.
Yep.
Some of the other things we do, particularly for some of the addiction people, are like some saliva tests or even some dried urine testing.
Okay.
The dried urine testing is generally neurotransmitters. So that's really interesting to see their pattern of neurotransmitters
Okay.
and how that correlates to their substance use and potentially coexisting those co-conditions that they've got going on, such as ADHD, anxiety, all of that. And once we can start finding, hey, this is where our neurotransmitters are off, now we can really tune in on the diet and the nutrition side and go, okay, this is what we need to do. Do we need a supplement?
Yep.
Or can we just fix it with nutrition? Some other things we do in-house are things like a zinc taste test, which I brought for you today
Okay, I'm
to
excited.
try out. We can even do like an iodine paint test.
Okay.
So iodine's really important in our thyroid function. If we've had issues with addiction and brain health, we may have other issues going on with some of our other organs.
Right.
So it's good to find out how's our thyroid affected with that.
Exactly.
We also will do like a nitric oxide saliva test.
Yep.
And then we also have a urine and saliva pH test.
Okay.
Those are interesting to also find out how well we're absorbing our minerals. And then along that lines, we also have a vital absorption challenge that we do. And so we actually give the patient more stomach acid prior to eating and see how they feel, see how they do. And most people need 3 to 4 capsules on that because we're almost all low on stomach acid.
Okay.
And once they start absorbing their food, it's amazing how much better they feel.
So is that kind of interrelate into the world of gut health? What you're talking
Definitely.
about right there?
Yes.
Okay.
Yeah, because, especially with the vital absorption, vital absorption has something called betaine HCl in it. So that HCl actually breaks off in our stomach and helps create more hydrochloric acid, which is what our stomach acid is made of. If we don't have enough hydrochloric acid, there's a lot of downward stream things that can't happen. We're not breaking down our food.
Okay.
We're not absorbing our food. On top of that, we're not sterilizing our food before it goes into our gut. If our food isn't sterilized before it goes into our gut, now we're looking at overgrowth. Now we're looking at overgrowth of bacteria, yeast, all sorts of things. And that yeast can cause a lot of sugar cravings when we have an overgrowth of yeast. So our microbes in our gut actually determine a lot of what we crave and what we want with food.
Right. Okay, so taking all of these different types of tests that you're talking about and looking at this, when you look at patients that we serve, do you find more often than not there's issues really across the board?
There are.
All of these.
Yes.
And you're putting together recommendations that really coincide with what might be going on from a therapeutic standpoint, or maybe even working with a psychiatrist.
Yes.
They may be, on a prescription for whatever diagnosis they have with their medical doctor. But this seems to run parallel and, I guess, in conjunction with those treatment plans.
It does,
right?
definitely. So, we can definitely take a more comprehensive viewpoint. I mean, I truly believe that food is medicine.
I do too.
But medicine can also be medicine. And sometimes we need medicine forever.
Yep.
Sometimes we don't. Sometimes food can eventually take over and our other lifestyle habits, and we may not always need that medicine forever. And I think that's also another really great thing about working out of a pharmacy is I have pharmacists available right there that I can go, hey, I want to put this patient on XYZ supplement. Is this going to be an issue with any of their medications? And they can check literature for me right there.
Make sure
within
there's
a few
no,
minutes, yes, and make sure
cross-indications.
everything's fine. Yeah, make sure, especially with things like SSRIs, that we're not giving them too much serotonin with things like that.
Do you notice, just curious, that sometimes the prescriptions that patients are put on, say some of the SSRIs or otherwise, impact some of these types of things that you're testing for?
Definitely. Yeah. There are a wide variety of nutritional deficiencies from medications.
Yes.
There's a lot that are known even just from birth control, which you think there's a lot of women out there on birth control. Yep. And I think off the top of my head, I believe B vitamins are one of the top ones on birth control. So again, we're going back to all of this stuff. Now we're messing with our hormones. We're changing how we feel all month long. We're getting vitamin deficiencies, and then we're having other issues beyond that.
And I feel like, and it's just, again, an opinion, but I feel like a lot of these things have been in the making for years.
Oh, definitely.
With the prescriptions, all of this stuff over time starts to culminate.
It does.
And now we're seeing a lot of the effects.
We are, yeah.
I even think, quite honestly, post-COVID, post that whole area, we have a real challenge on our hands, I think, with mental health and physical ailments related to vaccine or the illness or both, whatever, however you want to tease that out.
Yeah.
But I find that there's a lot of physical issues with the patients that we serve. And the thing that's always been perplexing to me, and we've had other guests on here that we've talked about this with, is this idea of functional medicine and integrative medicine and the application of it into the substance abuse, addiction, mental health field. Mm-hmm. It's been completely ignored for years.
Yeah.
I mean, quite honestly, if you go see traditional way of doing treatment is you go see a psychiatrist, it's completely subjective. I'm not questioning the training and the experience, but there's also physical things going on, but there's no diagnostics that are ever done.
No, there aren't.
And it's like we were talking today, when we were out at our facility, I don't understand why we don't do it. I mean, I have an opinion on it, but it seems like it's what patients need. They need to be fully evaluated for these things.
They do.
Because you can find deficiencies, you might find hormonal issues, you might find inflammation issues, you can find a whole host of unique biomarkers that can explain why you have the symptoms that you have.
Yes.
And that's going, to me, that's the real, when in our space we call it dual diagnosis, which is we don't just treat the substance abuse, we treat the underlying issue.
Yes.
And what that's really meant in our space is we treat any mental health disorder that we can diagnose vis-a-vis a doctor or a psychiatrist. Usually it's generalized anxiety disorder, major depressive disorder, or something in that realm, right?
Yeah.
True dual diagnosis, I think, is trying to understand why you have the symptoms that you have. And in order to get there, I feel like you're going to have to go into a little bit more critical thinking.
You do.
And it might take time.
It could.
But you're also going to need to look at some things, evaluate, connect the dots, have other points of diagnoses from, the therapist and other areas, put it together and make a recommendation.
Yeah.
And I think from there is where you're going to get the best outcomes long term.
Yes.
Because if you don't diagnose the right problem, then the treatment's going to always be off the mark.
Every time. Exactly. Even with supplements. If we're not getting to what's really going on, then the supplements, it's only going to do so much.
Right.
Even from that standpoint. Wish there was a one big fix-all, cure-all. That would be great.
Yep.
But even without some ways to diagnose, I actually listened to Dr. Greenblatt the other day, and something he's noticed in his practice is irritability. The more irritable they are, the more likely they are to be low in zinc and B6.
Yep.
So even sometimes something just as simple as that, even without a blood test, let's just throw a little bit of something at it. Let's see how we do. But we've got to get more people trained to understand more than just medication.
Yep.
And what medication can do. I think you need a whole approach. I think you potentially need medicine, you need therapy, you need supplements.
You need it all.
You need it all.
That's right.
And sometimes that means that should mean more than one person, but now you've also got another wall of, okay, well now all these 3-4 people have to work together for this one patient, which can be difficult in
coordinating in a fragmented system.
Yeah.
I totally agree with you. It's an area that I think we need to go in terms of substance abuse and mental health. We need to go into this role of being able to look at the overall health of the patients.
Yes.
But to do it, you have to have some competence too. And the medical doctors need to know what they're looking at and why they're looking at it and be able to make those calls. And so,
yeah, because you can ask them to run all the tests, but they don't always know how to read that test or know what to do with it. The other thing that I think we're finding a lot with some of the tests, and sometimes this is based on the lab that's used, but there could be a really wide range for what's normal.
Right.
I mean, I had a patient the other day brought in their D3 test, and the range for the lab was 30 to 100. For me, it's a much tighter window. I want your range between 60 and 80.
Mm-hmm. So what's the discrepancy there? I know exactly what you're talking about because I've been talking to our integrative doctor about this. You get these lab results back, and if I'm the layperson looking at it, I'm like, golly, I look like I'm in range.
Great. Yeah, everything's normal.
I know what the lab range is, but that's not really where it should be. Why is there a disconnect there?
So from my understanding with a lot of the lab work is they're looking at averages. This is, and what is a good, safe average. So basically they're looking at, okay, if you're below 30, you are severely deficient and you probably need D3 injections, things like that now. But as long as you're above 30, okay, well, you don't need anything ASAP, so you're fine. Now over 100, you get into you're toxic with D3, which I've done that to myself on accident. I got too much sun and I continued to take my D3. So I actually was able to quit my D3 supplement because I was getting plenty of sun, which was nice.
Could you feel just physically that you knew that something was a little off?
Not with the D3. I didn't. I felt really great actually at the time. Yeah. So I think that's another thing that's really interesting with labs. Sometimes we can feel really great and feel like we're doing good, and then it's not where we're supposed to be. Exactly.
Interesting.
So I find blood work is difficult, can be, but it's also very interesting.
Yeah. So let's jump into a couple of just interesting things. Because I read incessantly, and the role of caffeine in coffee.
Yes.
Is coffee healthy or is it not?
It can be. There's lots of studies out there. It can even be, I believe, anti-cancer.
That's what I've read too.
I think where we get into the weeds a little sometimes is even, it may not be great for our sleep.
True.
I think that's also kind of individualized though too. There are definitely people out there much more sensitive to caffeine.
Right.
So a lot of people actually coming out of addiction treatment in some of the groups that I've talked to, I tell them to try to limit caffeine after noon. That is not a popular sentiment when I ask them to limit their caffeine after noon.
I'm not sure I love hearing that, but I'm listening to you.
Yeah, well, I'm not always very good about it either. I try to not push it past 2 if I can. I try to let that be my limit for caffeine, whatever it's going to be, just to, again, kind of help my circadian rhythm.
And what I've read is if you're going to drink coffee, I've read that coffee has a lot of health effects, right?
It's got like antioxidants, things like that, especially if you get like the good mold-free tested coffee that you know is coming in, that you know it's organic, although organic's not perfect anymore, but we know it's organic. We know they're testing for toxins. That can be really big too. If it's not tested for toxins, you could be exposing yourself to mold every day. And then if you're drinking 24 ounces of it a day and you're drinking it all day long, you're just exposing yourself to mold all day long.
All day long.
That's asking a lot for your body to detox then.
So drinking coffee, prefer to drink it black?
Preferred. If you need a little bit of sweetener, I'm a fan of allulose or stevia. I know a lot of people aren't fans of stevia. It can have kind of a bitter aftertaste.
Yep.
There are a couple of kinds of stevia. I believe it's the stevia A. Doesn't have that bitter aftertaste.
Okay. What about the role of
monk fruit too? Monk fruit. Can't forget monk fruit.
Okay, that's an interesting one. I'll have to look that one up. What about the role of nicotine? Is it a nootropic?
It's definitely a nootropic. It's something I personally won't ever touch.
Right.
I feel like there's too many potential downside effects with it. I believe there are some people even low dosing it for cancer too.
Yep.
There's research out there about that now too. So, it could be really beneficial, but are we getting good clean tobacco again? Or are we getting the tobacco with all of the other chemicals and things?
So
and that's one of the big things with cigarettes is all the other chemicals.
Exactly.
It's not necessarily the nicotine that's in it.
Right. So these little pouches, Zins, et cetera, all these things that are everybody's popping in their mouth. Is that just pure nicotine?
That I don't know.
Okay.
So that would be
Yeah.
that would be something that is before you buy a brand, I would really research it.
Make sure you know what
and
it
make
is
sure
exactly
you know
in.
exactly what you're getting. And then the pouches too, I would try to find out what the pouches are made out of. Even tea bags are coming back that they're full of like microplastics, things like that are really toxic to our system. So I can imagine that potentially some of those nicotine pouches are going to have some harmful things in them as well.
You know, we were talking a little bit over lunch today when we were at our facility, and one of the questions I was going to ask you was, is a lot of what we're facing in terms of like healthy food and processed foods and seed oils and all these things we hear, is it really true that there's other parts of the world where they truly cook differently than we do?
There are.
And that people, because I hear about it all the time, and I know people personally that have gone and done what I'm about to talk about, where they've spent 6 months, 9 months, places outside the United States, and they felt like a whole host of ailments went away.
Yeah, the seed oils are terrible. They're highly inflammatory, and a lot of that is due to the processing of them. They're bleached.
Yep.
They're deodorized, and so what are all those other chemicals that they're doing? And they're also processed at high heat.
Okay.
So they're often rancid, which is why they have to be bleached and deodorized before they get to us. So they're already bad, I guess, is what I'm saying.
Where do you run into these? Just give me some I'm familiar with what
Chick-fil-A.
you're talking. Okay, that's what I'm wondering. Like, are they at all the fast food places? Like,
Yeah.
if I go get fried chicken, I'm getting seed oils.
I think Steak and Shake has switched to tallow.
That's what I read that too.
Buffalo Wild Wings has switched to tallow.
Okay.
So I would research the restaurant if you can that you're going to, find out what they cook their fries in, things like that. And so actually I just happened to look up Chick-fil-A the other day, and they had switched from peanut oil to canola oil. So still not the best oils, but
they're moving in the right direction.
well, maybe. I don't know. We'll see on the canola oil. We were discussing how they didn't taste the same. It's the canola oil, so they don't taste the same as they used to. But
okay. So are the seed oils primarily in fried foods? Is that where we're going to find them? Or
no, you're going to find them in everything.
Okay.
I made homemade chili the other day. I wanted to have a few Fritos with it.
Seed oils.
Soybean oil. So it, like everything else, I mean, it's corn and salt are the other two ingredients in Fritos. And then they use soybean oil. And I'm like, okay, well, I guess I'm out.
I feel like where we're moving towards, and maybe it reminds me a little bit of like my 8th grade health book, which is eat whole foods.
Yes.
Like if you come into a grocery store, they used to say, go to the perimeters.
Yep, that's exactly, yep.
Find the things
that's
that
what I
are,
tell all my clients.
If something can go bad pretty in the near future, it's probably good for you.
Yeah. Even if you're not getting like organic, even if you're getting some of the other stuff, obviously wash your produce, but it's still going to be 10 times healthier for you than the stuff in the middle of the grocery store. Yeah, that has the corn syrup and the added sugars, and they're getting really sneaky with the sugars now too. Even some of the alcohol sugars may not be the best, but you'll find them in a lot of keto-friendly foods.
Okay.
So, and depending upon the state of your health, that sugar alcohol could still spike your blood sugar if you're in poor health. If you're already headed down the path of insulin resistance, it's going to spike your blood sugar.
Yep. You know, on that subject, just one of the things that we've noticed over the years is when you have somebody that comes into treatment and you take the alcohol away, immense cravings for sugar come out.
Probably that candida. They probably have a candida overgrowth down in their intestines somewhere. So that's probably a lot of it. I mean, you think about all the sugars used to make alcohol. They've been getting all this sugar and feeding that monster all the time.
Right.
and now suddenly we don't have it.
Yep.
So I'd look at potential candida treatments. You can go supplement or prescription on that. Looking at that vital absorption, just adding in some more stomach acid. They can even do something as simple as apple cider vinegar to help increase their stomach acid.
Okay.
And to help with that yeast overgrowth.
Interesting. Okay. Hey, just kind of shifting gears just a touch, but still similar line of thinking. What are your feelings on the GLPs that are being utilized at a higher and higher rate?
I have opinions. Okay, so I personally have used a GLP-1.
Okay.
After I had my second baby at 39, I was very, very stuck. I was very, very toxic. I breastfed for 1.5 years. Could not lose the weight.
Okay.
I had immense sugar cravings.
Yep.
I was one of those that people ask me what your favorite food is. I was like, chocolate. I will eat chocolate all day long. I could live off of it. So I never had the ability to take one bite of a dessert.
Right.
Even if it wasn't my preferred dessert.
Sure.
I never had the ability to take one bite and go, okay, I'm done.
Yep.
That GLP-1, life-changing. There was just something that
turned it off.
Just turned it, and suddenly I could take 1 or 2 bites of this delicious tower of chocolate cake and go, oh, I'm good. I don't need any more.
So, we're noticing, and a lot of this is being published and talked about out there, but we're noticing it in our own patient base. The reduction in cravings for alcohol has dropped off like a cliff.
Huge.
So, it's interesting. You read about, the alcohol industry and people aren't drinking as much. Younger people aren't. Older people aren't. Nobody's drinking as much. And they reference all these things like, well, there's the negative effects of drinking alcohol with disease. And I'm like, yes, but I think people have known that for a while, but maybe it's more apparent now. They're using other things, marijuana's use, this, that. Okay, that could be definitely a part of it. I really think this use of the GLPs is a monster.
It could be. Yeah. And I think we have to individualize that for people. I have a friend that tried taking GLP-1. She even tried taking the Zepbound. So it's got GLP-1 and I believe it's the CCK. So it works on the 2 different hormones.
Yep.
Both times she was so sick. It just to her stomach, like just debilitating. So for whatever reason, that just doesn't work for her. So it's too much for her.
Was she not able to get through kind of that? Because I've always heard there's a period there, right? Of like maybe up to a month. She could.
Well, I think she made it past a month or so on the Zepbound. And part of that was because she actually even halved the starting dose. So she was taking half of the amount that most people start with. And she was still having debilitating stomach pain. So, I mean, there are some potential side effects to look at with GLP-1s, but I think they could be truly game-changing for addiction. I mean, I've never had a problem with alcohol. Like, I was just like a maybe 1 or 2 if we're out, for dinner, but I never was one that I craved it or I just had a hard day and I was like, oh, I need a drink. And I've never been that way. But even when we would go out to a friend's house and everybody else is drinking, I'd have one and be like, oh, I'm kind of
just don't eat.
I just didn't want it. Yeah, it's kind of the same thing that goes back to that big old chocolate piece of cake.
That's right.
It was good.
Yeah, it
was fine. Yeah, I didn't.
I think it's kind of a game changer too. It's like we were talking today with our doctor, Dr. Latif. He made a really interesting comment that these double-blind, placebo-based studies, by the time you get through them and you get them published and they're out, it's 5 years old.
It takes so long to do them.
Right.
Then you have to have them peer-reviewed.
Exactly.
And go through that whole publishing process. Yeah, we're way behind. And I know they've been studying the GLP-1s, but we're behind.
The evidence is out there.
It is.
And we talk about that internally all the time as, use evidence-informed things that we know that work. If you're always waiting around for these immense studies to come out, you're going to always be about 5 years behind.
Yep.
So you want to look at things that are credible. As long as you're looking through the eyes of people that are competent and trained and understand what's going on, I think you can stay ahead of these trends, or stay on these trends.
Yes.
And know what's good and what's appropriate, stay away from what's not, and put them into practice.
Yeah. Well, and I know we talked a little bit about it at lunch too, but just the GLP-1 itself, it's been out for over 20 years for diabetics.
Yeah.
So there is a great preponderance of evidence out there that these are overall safe and effective. Now, that's not to say, again, that there aren't side effects and that you shouldn't research that and go, is this worth the side effects for me?
Exactly.
We all sit there and hear the commercials and go, ugh.
Right.
Like, I'd have to be pretty bad for some of the side effects that they talk about on some of those things. But again, that's something for people to weigh and work with their practitioner.
Yep.
And multiple people, maybe even whoever's helping with nutrition, and get multiple opinions.
Yep. Okay, so I've got a pretty good feel, for all these different tests that you're doing. Now, do you want to do one on me?
Yes, let's do one.
Okay.
I actually brought a zinc taste test for you.
Okay.
So it's fairly simple. This is I'm going to call it's a mild zinc solution.
Okay.
It's about 2 milligrams per mil. So, if that means anything for some people.
Does it have a taste? Does it taste strange or good?
If and when it has a taste, that's how we'll know how much zinc you have. So I'm going to have you actually swish it in your mouth for 10 seconds, kind of like a mouthwash. Yep. Okay. I'll time it for you too.
Okay, perfect.
So we'll time that. Then you will swallow the zinc, and then we will time again how long it takes for you to taste something. Anything, like any change in your mouth that you feel, let me know.
You got it.
Because it's different for everybody. I hate to give ideas because I feel like if I tell you an idea, then that's what you're looking for kind of thing. Right. It's like, but it could be furry. It could be dry. It could be fuzzy. Okay. It could be bitter. All right. It could be sweet. Could be metallic.
I'm ready.
Sour, all over the place there. So
let's do this.
All right. So there you go. I'll let you take the cap off. I'll get my timer ready here.
Can I drink this whole thing? The whole thing?
Swish it in your mouth. And then, you'll swallow the whole thing.
Okay. So I put the whole amount.
The whole amount in your mouth and swish around. It's only like 5 milliliters.
Okay. You ready to go?
Ready. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Swallow. Anything? You're wiggling, so
yeah, feeling
there it is.
Now.
Okay. So it was about 15 seconds.
Okay.
So you are low in zinc.
Okay.
Good. So that puts you in category 4.
Category 4.
Yep. So it takes about 10 to 15 seconds. What did it feel like for you?
Well, when I first, it's really hard to describe. Actually, it almost a little metallic.
Okay.
Maybe a touch.
Yeah, metallic.
I don't know if that makes sense.
It does. Yep. That's
slight metallic taste.
Maybe a little mineral-y or
I would say that. That's a good description.
Okay.
Yeah, I would say almost like a mineral water.
Yep. So I would recommend you take 40 milligrams in the morning and 20 milligrams in the evening.
Okay. Okay. And
then you can repeat this test in 4 weeks.
And zinc is good for you from an immune standpoint, too, right?
Yes. Yeah, it's huge. Zinc is actually helpful in more than 200 body processes that we use. So I'm...
Okay.
Yeah, well, there's a lot. It can help with fat loss.
Oh, okay.
It can help with blood sugar, with glucose regulation. It can help with ADHD. So again, kind of going back to moods. It can help with wound healing.
Okay.
So it can help with scars, all sorts of stuff. So
interesting.
This will be yours to take.
Okay. Well, thank you for that.
Yes.
No, that's very helpful. My wife will be pretty excited that I did something.
I brought one for
today.
her too. So.
Oh, good. I'll take that home
you can't
tonight.
go home and just tell her about it. Now you got to let her do it too. But now you get to facilitate.
Yeah. I told her I did it. Now she gets to do it with me.
Yes.
Okay. Yep. Good. Well, thank you for that. Hey, just as like a corollary to this, as we're talking about nutrition, sleep and exercise, it goes hand in hand, right?
Oh, definitely.
One of the biggest issues that we have with patients that come to us is their sleep is completely wrecked.
Yes.
And they can't sleep. Their sleep has been poor for a long, long time.
Which sometimes is why they end up with using substances.
That's exactly right.
Yeah.
Yeah. So are those areas that you do a little bit of work in as well?
I do. Yeah, I do some work in those areas as well. I'm not a certified personal trainer or anything, but I've been in the nutrition and exercise space for a very long time. I mean, as I mentioned earlier, I went to OCU. I grew up dancing.
Yep.
So I know a lot about staying physically active and physically fit.
Yep.
So some of that goes back to with the sleep, goes back to our circadian rhythm, waking up in the morning, getting that morning light. And then my personal preference is to either go to the gym right before or right after that. That works for my schedule. I tell people, I'm stealing this from Dr. Gabrielle Lyon, but muscle is our longevity organ. It is very, very true.
Yep.
The better muscle mass we have, the better we're working out our muscles, the better our brain health is going to be too. It's amazing how those two things go hand in hand.
Exactly.
Then when we're doing those things, it helps our glucose regulation, which helps our mood and things. And then again, sleep is another byproduct of that we have better sleep.
That's exactly. So as I'm listening to you, do you follow Peter Attia at all?
I do.
Outlive, yeah. Mm-hmm. So he's been a big proponent. I actually am trying to follow a little bit of his regimen right now where you're like in zone 2 type training. Then you have a 20% that's like your VO2 max, and then you do strength training. And it's really interesting to follow it because if you do, like he's a big believer that you should spend about 80% of your aerobic activity in zone 2, which I guess is being in
a little lower.
It's a little lower, right? It's a little lower than that?
No, I'm saying it's a little lower intensity.
It's a lot lower intensity. Yeah. So if you, like when I pay attention to where my heart rate is as I'm running, if I'm trying to keep it, say, under 126.
Which is tough sometimes.
Which is actually harder than you think.
Basically, we should be able to get up and walk right now and continue having this conversation. That's zone 2.
That's zone 2. That's exactly right. And then you need to have a little bit of it where you push hard. Yes. You're really exerting. Yeah. Right?
So I guess I don't know enough on some of his opinions. Is he a big fan of HIIT then?
I think it's maybe however you want to apply the kind of hitting that 20%, that anaerobic, if you will, VO2 max, you're getting your heart rate up into that high zone.
Okay.
And so I guess HIIT would probably work. I'm doing like track work to do it. But overlaying all of that is the strength training. He's a huge proponent of that. And that longevity, one of the direct like correlations to that is what your VO2 max is and what your strength training is.
Yeah, your cardio respiratory fitness is huge.
It's huge.
And some of that can even go into our brain health.
Absolutely.
That's where we get the BDNF, or that brain-derived neurotrophic factor. And a lot of that we actually get from lactate from our muscles. So getting those kind of the back and forth, it helps increase that lactate, which goes to our brain and tells our brain, hey, you need to make new nerve cells. You need to make new brain cells to kind of power everything on, that neurogenesis.
Exactly. Which for a long time, we didn't think we could even have new brain cells, right?
Oh, yeah. Up until I would say probably even somewhat recently, I didn't think we could make new brain cells. So finding out this research
is huge.
It's huge.
I agree with you.
Think about how much it could change outcomes for addicts.
I totally agree.
Looking at, I don't know if you guys get to look at brain scans and things before. And then what would be really interesting is to do a 6-month, 12-month type program that did some of that HIIT and the strength training. And the HIIT could be a strength training based even.
That's right.
Starting as simple as 1 minute on, 1 minute off.
That's right.
Or 1 minute at full speed and 1 minute off. And I say full speed, you want like 80% of your max, which I think is pushing zone 4 or 5, I believe. Okay. I'm not 100%
I think you may be right.
But yeah, it's pushing that higher end of where you want it to be. And you're doing that full blown for 1 minute, whatever it is, whether it's squats or you're running. I think on some of this, doing like the bike is really great. Rowing is really great. And then take a minute break.
Yep.
Do that 10 times. So 20 minutes. I mean, that's not very long at all.
It's not.
It's a very short time of your day that you have to spend doing this.
That's absolutely right. And the things that we're talking about right here, I mean, they seem somewhat elementary to an extent because you hear this all the time. But if you put this stuff into practice,
It's so important.
you can absolutely impact your mental health.
Really can.
And when you think about the space we're in with addiction, we're really treating mental health. Our patients don't feel right, so they use substances to
and
alter their state.
why didn't they feel right? What is that? And how can we help them to continue to feel right
There you go.
and have those tools to continue in the world?
Right. I don't ever proclaim that we have all the answers, but I always like to say,
Wouldn't that be great?
Yeah, and nobody does, but I really feel like in our space, you want to be very curious.
Yes.
And don't get locked into what you think works, because this is kind of the new frontier. I mean, it's like the mind, we don't fully understand it. So we need to constantly be pushing, trying to discover ways we help people with emotional and mental health issues. And I think this little area that we're moving into, where you're really getting into some of the unique biomarkers and understanding what the root cause of your symptoms are, not just what your symptoms are, and then figuring out critically thought through ways to address them. And if you pair that with good modern medicine and therapy, I think you're going to get extraordinary outcomes long term.
I agree completely.
Yeah.
Yes.
So as we kind of circle this through and we look at where we are in today's world, right?
Yes.
We've got the, not on a political realm at all, but just looking at kind of the Make America Healthy Again movement, right? It's huge. Frankly, I think it's kind of a big deal.
What a great concept.
Right?
We spend the most in healthcare, and I don't think we're last, but we're way down there on our outcomes and how healthy we really are.
That's right.
So I don't understand the politicization of it. It's such a great idea. Why wouldn't we want to be healthy?
Right. I think
Why
if
wouldn't
it was,
we want to feel great?
If
and
it was
get to
anybody
run
but
around
Trump talking about it, they'd probably be on board with
That's
it,
probably
just to
true,
take the
yes.
elephant out of the room. But the initiative is smart.
It is.
It's exactly what we need to be doing. Yeah. And it's going to, I was even listening to some things this morning, last night. They're starting to tackle the addiction category now.
Yes. Yeah. I haven't gotten to listen to all that yet.
Yeah. And I need to kind of go in and break it down, but looking at all the disparate, fragmented federal agencies and how they're going to look at what funding's going to go towards, and, recognizing addiction is a disease. How do you treat it appropriately? And then the time factor, which is huge. We've talked about this in other podcasts. It's one of the essential ingredients in getting good treatment is being time in treatment. It doesn't always have to be residential, but being in an environment where you are safe and you can maintain sobriety, learn the life skills you need, have community around you, and get good science-based medical treatment. If you can do that for a duration of time, at least a year, your chances of success skyrocket.
They do. Well, and I think that goes back to having a good team, too.
That's right.
Getting a nutritionist or a dietitian or someone out there that can understand what you might be lacking and help you find it in food.
That's right.
Get them to, loop in with your therapist, with your family. These can all be family events. If you're talking about changing your nutrition at home, that might need to be a family meeting.
That's right.
Wife might need to come, mom and dad might need to come, or whoever is going to be there to support the person that's recovering. I think that could be really vital. The person that's recovering isn't the only one that has to buy in. They talk about buy-in a lot, but it's not just them. It's everybody around them that has to buy into it too. Or I guess even if they don't agree, they have to be on board.
That's right.
And they have to be willing to help make the changes.
Absolutely. I mean, there's an element of discipline that comes with this.
There is.
And we're dealing in our space with the addiction population. Compliance hasn't been their strong suit.
Yes.
Okay, maybe compliance in using, but not in compliance in doing other things. So how we teach and introduce these things in treatment is really key. That's the discerning aspect of it, because when people come into residential treatment, they're pretty ill. A lot of them need to be medically withdrawn from the substances that they're on. We're in almost a primal type state of getting you healthy so that you don't hurt yourself. And then we teach some basics, and then in due time, we're introducing these concepts.
Yes.
Now, we're doing a lot of the diagnostics early on to understand it, but if you're going to adhere to this and be compliant with it, you're going to have some motivation.
You are.
Some discipline. Now, I think even the most disciplined people, it's hard. It's still hard to keep up with all of this.
It is.
You get busy, life gets going, you're on the run, and then you feel like, well, if I can't do it all perfect, then I can't do any of it. But I think in there is just the effort and knowing to try to adhere to it, stay at it. But even some help could be had with nutritional coaches or health coaches or just different ways. I mean, do you work in a capacity like that with some of your people where you can just kind of coach them through this so they can develop the healthy habits that they need?
Yes, yeah, definitely. I even have basically coaching packages that people can do. There's 3 months or 6 months or however long we feel like they might need.
Yep.
And they get me for that time period. Basically, they get a 1 hour time frame with me for sure every single month.
Yep.
They get my cell phone number. So if we have some struggles at home, that's fine. Holler at me if you have a question, So obviously I'm not a therapist, so I can only do so much, but I'm part of that team and I'm there for you and I'm there to be a part of your community.
Yep.
And that's of course not to say when 3 months or 6 months is up, I'm not cutting you off, of course, but but that is the main hand-holding time is the thought behind that, depending upon where they're at.
Yep.
So
when you look at going back to kind of where we're at with this Make America Healthy Again movement, these changes that are all being had, do you feel like this is a fad or is this something that can be sustainable for a period of time?
I hope it's sustainable. I believe it will be. I think, like what you said earlier, I think when the administration turns over, because it will eventually.
Exactly.
I think if a lot of these things are in place, my hope is that the next one keeps them in place.
That's right.
There are so many veterans and things from the addiction side of what they're looking at doing that could really, truly use our help. I think that would be huge. And then I think what they've done with the food pyramid, it may not be perfect, but it's a step in the right direction.
Moving in the right direction.
Exactly. They haven't really addressed like some of the glyphosate concerns and the seed oil concerns and things like that, but they are doing things on the other end to try to remove a lot of those. It's not mentioned maybe in the food pyramid, but part of the point of that is they're not supposed to even be in there.
That's exactly right.
So
I think that stuff's coming.
Yeah,
still.
I do too.
I actually really appreciate it. I think it is sustainable, and if they use this time wisely, they can put in place some things that companies, once you start getting the institutions in fast food companies and getting a lot of these different people that have been motivated, I think, the wrong way to adjust to this, and you get awareness out in the public around it.
There's so much social media.
That's right.
So many of the big names are, again, like I said, the food pyramid's not perfect. So we may all have our own take and little nitpicky things that we can find with it that we want to change. But there's so many big names out there that have been promoting this type of nutrition and food and eating for years.
Absolutely. Yep.
That this just coincides, and we have so much more knowledge now from social media. Yeah, some of it's not always 100% correct.
That's
You've
right.
got to do your own research and go, okay, did what they say, is that real?
Right.
Go find the study they mentioned and find out, did they take just one tiny little sentence out of that study to support their idea, and what does the rest of the study say?
Right. Yep.
Where are we on that part of it? Is some of it is up to us to go beyond social media and figure it out. Because, otherwise it does get politicized on social media. And I think that this is very sustainable. I think eating that way is very sustainable. And I don't know, I'm going to keep doing it. So
I think you should, and just as we're kind of, bringing this really interesting discussion to a close, I feel like with where you focused your career and your interest, you have a tailwind right now. That
would be great.
It's out there. I mean, people are pushing this. We're pushing it at a federal level. I think we're pushing it through all of these avenues you're talking about. Where do you kind of see your focus here over the next year or two? Are there certain areas that you're really paying attention to, things that are on your radar?
Perimenopause is huge, especially right now. I think that's going to continue. I mean, we're all just going to keep getting older.
That's right.
So perimenopause, menopause, I see potentially being really huge, even more so than it is now. I think with the knowledge that's coming out with that too, is that you find out that that's when a lot of women turn to substances.
I think you're 100. There's
so you're going to start seeing women's in 40s and 50s, in 60s that are going, I've been drinking every single night for years.
Right.
And finally, it's a problem. It's just wreaked havoc on my body.
And the thinking there, just correct me, is they go through this period, this perimenopausal, menopausal period, and they don't feel right.
No,
and they're
they
struggling.
Don't. And they're brushed off.
And they haven't been able to really address any of it.
Mm-hmm, exactly.
And now, I guess, what have we done? We've taken off the black box warnings on some of these
estradiol
things.
patches, yes.
We've opened it up to say it's safe to treat them now.
They're finding out that there's not as big of a cancer risk as we thought, especially based on the way you take the estrogen.
Yeah.
Topically, it's not processed through our liver, whereas when you take like a tablet, it's processed through the liver, so you're running a bigger issue with detoxification, things like that. And then you go back to birth control.
Yep.
Those are all synthetic. Those do not match what our body makes normally when it's when it's cycling the way it should. So whether you choose to take it or not, that's something you should be aware of and think about what are the downward effects that this is going to have.
Yep.
And there are a lot of women that end up getting on birth control in perimenopause because now we're at least giving her synthetic estrogen, giving her a little bit of synthetic progesterone, making her feel a little better, but we're tearing up her gut and all these other things. So anyway, doing something like the patches, something more bioidentical, to me is preferred.
Yep.
I'm already on progesterone myself, so I'm just someone that has always naturally ran low progesterone. And now as I've hit 41 and I'm starting to enter that, I can tell that some of that is a little off.
It's starting to change.
And that's where I need a little bit of help is the progesterone.
I think that focus, and we talk about it internally, I think that is a really interesting, if you want to call it a market, but a group, that premenopausal group of women.
They're so much more powerful than they realize, too, to make change.
I agree with you. So, well, hey, this has been a really interesting discussion. I appreciate you spending time with me today and coming out to visit us earlier today. So as we move through
the ranch is beautiful.
Oh, thank you. It was actually a pleasure to have you and your team out there today. But as we move through this in the future, we'll probably have you back on to maybe talk about some new and different things that we're working on.
That'd be great. We've got lots of rabbit holes we can go down.
We'll do that. Well, thank you. I appreciate it.
Thank you.